Welcome to Shri Medical College. Today we will explore the role of physiotherapy in stroke recovery. Physiotherapy aids in stroke recovery. 5 days a week, patients in a 7-day stroke recovery program receive 45 minutes of physiotherapy. Lost abilities require intensive therapy. When a patient is making progress and meets treatment goals, they should continue to receive treatments. Long-term care needs community rehabilitation services. Short, frequent physiotherapy bursts focus on sitting, standing, and walking 24 hours after a stroke. Repetitive task training helps people regain mobility and execute normal duties. Physiotherapists utilize assistive gadgets for stroke recovery. Treadmills improve walking speed and endurance, and robot-assisted devices help patients walk. VR for medical instruction could supplement normal care, but not replace it. Long-term stroke rehabilitation goals include returning to employment or the community. Most stroke sufferers have chronic diseases. Future planning is challenging. Long-term disease patients need treatment schedules that allow for periodic physiotherapy check-in to monitor health changes. Increasing physical activity can lessen the risk of another stroke by 35%. Physiotherapists utilize circuit training to increase patients' mobility and functional ability so they can walk farther, faster, and more independently. Strength and endurance training reduces disability. After a stroke, balance can be improved by strengthening the core and redistributing weight and gait. In acute stroke instances, a specialist should evaluate the patient's condition within 4 hours of hospitalization. Lap trays can prevent shoulder subluxation. Stroke patients, their families/caregivers, and healthcare staff, notably nurses and allied health professionals, should all get manual handling and placement training. Those who can't move much can relax with their hands or feet up. Within 24 hours after the onset of symptoms, a trained physiotherapist should evaluate a stroke patient experiencing trouble moving to determine the safest ways to transfer and mobilize the patient. Start mobilization, out-of-bed activity, within 24 to 48 hours after stroke onset, unless palliative care is offered. Stroke sufferers shouldn't do rigorous out-of-bed exercise within 24 hours. Those who can get around without much aid shouldn't be mobilized within 24 hours. When traveling to rehabilitation centers, patients cite a lack of rehabilitation team capacity and transportation choices. If you have problems sitting still, try stretching beyond arm's length while seated, preferably with supervision or support. Due to diminished limb and trunk motor control, shifting sensation, and a centrally directed shift in body perception, stroke survivors commonly lose their balance. Loss of balance increases fall risk and reduces self-esteem. Recent study shows that trunk workouts increase trunk performance and dynamic sitting balance, while task-specific training improves dynamic sitting and standing balance. Many stroke sufferers want to walk independently again. If a stroke victim's walking ability is reduced, they may become socially isolated. If you have problems walking, repeat customized walking drills or walking components. Group therapy, with a focus on overground walking practice. Treadmill workouts with or without weights. Treadmill exercise can be utilized for gait re-education/training to improve aerobic capacity. Patients with severe functional impairments may benefit from rating the amount of body weight-supported treadmill exercise. People who can walk freely after a stroke should get treadmill training with or without body weight support, or other walking-oriented therapy, in addition to other treatments. Non-ambulatory patients can benefit from higher repetitions of electromechanically assisted gait training for stroke rehabilitation. Therapists save time and energy using automatic electromechanical gait devices by not manually setting paretic limbs or assisting trunk motions. These devices can be robot-driven exoskeleton orthoses or electromechanical footplates that emulate gait. Exposure to an external rhythm can improve the time and variability of motor responses, especially in motor occupations with sophisticated timing requirements or in disorder affecting movement timing. Overground walking refers to walking-related activities on a solid surface, where the physiotherapist may observe the patient's gait and coach them in exercises to improve their gait. Overground gait training can be done any place without high-tech equipment. Up to 85% of stroke survivors have compromised arm function, and 40% have persistent deficits. Physical therapy for hemiplegics focuses on restoring arm function to improve quality of life. Bilateral arm training improves bimanual coordination by using both arms. Bilateral arm training involves performing comparable but unique motions or tasks with both arms simultaneously. These tasks may or may not repeat. Individuals with hemiplegic stroke must use their affected limb during task-specific training with constraint-induced movement therapy, CIMT. Individuals with 20 degrees of active wrist extension and 10 degrees of active finger extension should receive intense constraint-induced movement therapy to improve arm and hand use. Functional electrical stimulation improves upper limb activity compared to no intervention and training alone. Electrical stimulation may help stroke patients restore upper limb function, according to research. Mental practice, MP, is a training approach in which a person cognitively rehearses a physical activity using me to improve motor skill performance. Motor imagery, ME, is the mental process of rehearsal for a specific action to increase motor function. Stroke survivors can now do more aerobic exercises. Aerobic exercise programs, such outdoor walking or treadmill training, and sport and exercise classes, as well as technology, fall under this category, for example virtual reality training. These choices, validated by science, allow therapists and patients to choose an individualized program within a suitable time limit and setting. Neurologically impaired people benefit from entire body immersion in water. Hydrotherapy is used to treat neurologic and musculoskeletal problems. Even full recovery stroke survivors often feel fatigued. Fatigue is characterized by a lack of energy or an increased desire to rest every day and is observed by over 40% of long-term stroke patients, limiting their capacity to perform daily living activities. Join Shri Medical College's Bachelor of Vocation in Physiotherapy and take the first step toward a successful career in physiotherapy. We are here to assist you in launching your career as a physiotherapist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.